Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll. Welcome to the NCD 365 podcast, and today we are very privileged to host our very first podcast, and we are joined by quite the NCD champion here, Mr. Ken. He'll be talking to us a bit about his stories, a bit about his life lessons, being a person living with non-communicable diseases, but also a bit about his life experiences being in the space and working in the space. But before that, a brief introduction to the podcast is that in this podcast, we're really talking about NCD champions, people who have lived with these diseases, non-communicable diseases, and people who are sharing their experiences out there to encourage others to know that they're not alone, but also to use these stories as tools of advocacy and tools of change. And without further ado, Ken,
yes,
give us a bit of an introduction to yourself before we sort of jump into the whole conversation.
Okay. Thank you so much. My name is Kenedy Anjejo, mostly referred as Ken. I'm a native of Kisumu County. I'm a father of two boys, and I'm a family man.
Clearly.
Yes. I also love life. I think at the moment I'm also a kidney patient. Yes, I'm having a kidney failure, so I live a near normal life, not a normal one, and that's where my story begins. Professionally, I'm a researcher. I'm a trained anthropologist, and my life in career has been through research consultancies. I'm also passionate about doing community work, and as also I spend some time volunteering myself in community activities on and off when I'm available and energy can allow me to do. So that's me in a nutshell. Yes.
Interesting introduction there, because most of the time when people think of us as people who are living with non-communicable diseases, they tend to think that we are defined by sort of the diseases that we live with, as opposed to all of the other experiences in life that we get. And so, especially through introductions, like people should get to, have this wholesome experience of us as patients, living with these various non-communicable diseases. And so I'll sort of go into the first question, really, and probably this will be the longest one. And this is, tell us a bit more about yourself, yourself as an NCD champion, and where your story started from, and sort of where you began, how you knew that you are having kidney failure, and as a result, how then that translated into the steps that you took after discovering that. So what is the origin story? How did it all start? How did you notice?
Yes, I will begin by saying, for me to get time to even speak about this story, at some point you come to realize that having maybe a condition in your body is just a small fraction of you. There's also the bigger person. So that is the energy that at least rides me through in this particular space. I think it has been 3 years when I could really realize I had some problem. I think was 2019. This was there was a period I went back to school in 2017. I got a scholarship late in October, So I joined in October for a master's program at the University of Nairobi. So then first we rolled into 2018. So we started our first year, then coursework we are through by end of 2018. So 2019, early 2019, I think that is when now I started realizing there was a problem. The way this came was the most interesting story out of this. We had our classes in the 5th floor. And this one is, for those who are non-University of Nairobi, the Gandhi wing. So the classes were in the 5th floor. The lift used to get to 4th floor. And it was one lift for serving a very big building. So in most cases, you'll never get time to use the lift with your classes. So you'll be forced to do stairs. So what I used to realize while I was doing these stairs was when I go through maybe the first floor, I get serious fatigue, which was unusual. I was this strong person who could even run through the stairs up to the 10th floor without feeling anything. So I used to get fatigue, start sweating. So by the time I get to 5th floor, when I get to class, I love to take like 10 minutes to just settle in and maybe start off what people are doing. So it went on like this. I didn't take it seriously. I would say maybe uzee inaingia, things like that.
You're becoming old.
You're becoming old while young. So it went like that. And then I think something around March, started feeling some serious headache. Then I decided to go to the university clinic. So when I went there, normal pressure, these are vital signs that were taken. Then among the many things that was, your pressure is high. Okay, fine. I was not even, what is this pressure? What is it? So, okay, fine. I was told to go to take some medication. Most of it, I was not even sure it was given for pressure. It was maybe to check the headache. So I went back. It went like that. Then now there was a recurrence of headache, constant headache. And then the kings of over-the-counter drugs. So I was told a good one for headaches, constant headache, go for Betapin. Betapin is very strong. So I always had some 3 or 4 pieces of Betapin in my bag. And maybe also in the room where I was staying. So it was always one thing following, because the headaches were always recurring. So what I didn't realize, this headache was just my pressure, which was always rising. So one moment it happened, I think I was from school back to the house. Then now I had an attack, high pressure, hypertension, ile ajusan. So to a point that I collapsed. He said the house. So I was able to reach somebody on phone, and the caretaker, they were able to take me to the hospital. That was, I think, around April. To Metropolitan Hospital. There the pressure was very high. I think it was something like 190 over 150 something, something around that. So I took around 5 days to be managed, things like that. But along that, there was a lot of conversations with the medics that were coming around. So what was coming from them was, I didn't present conditions that will predispose me to having hypertension. So one of the things I had them saying that there could be a cause. So what they were telling me, I was suffering from secondary hypertension, meaning there was a primary cause. So what was this primary cause? So there was possibilities. Am I diabetic? No, I'm not. I'm not overweight. So all the
sort of checking through a checklist.
Yeah, doing a checklist and eliminating things. So it went like that, and now they were getting a place. You could also check your kidneys, but by the time I was stabilized after 5 days, I just went back. Then it happened, I think around September, the same thing happened again, and I was back to the hospital. So at that point they said no. Now I think I was taken through blood test, and there's a normal blood test for kidney problem, the creatinine test. So my creatinine was also very high. So that is when now things were trying to run around the issue about kidney. So we waited for a nephrologist, since this was this private facility that they have to call somebody to come. But by the time I was leaving, the nephrologist had not come. But at least they were now getting close to saying you have a kidney problem that is causing you hypertension. So it went like that. Then that was now 2019. Then that's around August. Then in December, the normal routine, people come for holidays in December. So I decided to go to Aga Khan, Kisumu. So Aga Khan, I think I was told through a friend, I was also sharing the story with my friends who were just coming to visit me, telling me, no, Kenda Kisumu, go and see this doctor. So I went to Aga Khan, I was done these several tests. Then told me, no, you have a serious kidney problem. So at that time, my kidney function was at, filtration rate was 16%. 16 is very low. That is like stage 5 chronic kidney disease. So basically, the best is at that point I should be on dialysis, meaning my kidneys should be supported to work because they were really performing poorly. So I told you, what are the options? I don't think I need anything invasive on my body
at the moment.
At the moment, I'm not ready for something.
What options exist?
What options exist? So he tells me, there's nothing like medication, things like that. He tells me, no, we can try that. There are people who, by chance, you put through medication, the kidneys always resuscitate and recover. But we can try that. So he told me, you need to do that for a period of 3 months, then do a review. Which we did by around March, when now Corona was setting in. Then now there was no marginal improvement. Then you also try, wait, let's do another 3 months. So, but at that point, it was now telling me we need now to get prepared for dialysis. I don't see this kidney improving. So then now I told him, okay, now for dialysis, how does this thing happen? Still, okay, you need now to have a passage where this dialysis is done from. It can never through a catheter or a fistula, but now catheter is a bit painful and is always done through emergency. But if you're somebody who still have time, you can just do something called fistula on your arm, so that you're always ready in case there's a problem. You can always be started on dialysis. So since now they also, at that time I was in Kisumu. I decided now not to return to Nairobi after March, just to stay after now the Corona thing set up. So we stayed through around that period. Now we are looking at this opportunity where the government could relax the curfew issues, so that I could travel to Nairobi for this procedure. The best doctor was Nairobi, but there was alternative in MTRH, but I'd preferred the Nairobi one. So luckily in June, I managed to get some of my friends who were traveling back to Nairobi, who had a pass. Then we went back, I had the procedure on my left arm. So then I returned after about 2 weeks. Then I think after a period of 1 month, I think July 18th, I started my dialysis. And now that was now the other life. Now I started living with the on dialysis. I had to change a lot of things. I decided now to move, I would say for now permanently, from Nairobi, where I was staying. I had to move my things from Nairobi to bring it back to Kisumu, now staying with my family. So I started a new life. I think that was the most difficult period in my life.
The transition.
That 6 months from July to December. I couldn't even understand myself, but I was wondering, what is this? Is this the person I knew about myself? So there are all many things you're trying to do. I was this very vibrant person,
very active
in everything, politics, work, traveling, doing this field research, going everywhere, here, flight, where. Now all this thing has to stop. And you have to sit in a house, locked there. Yes,
grounded.
Corona has also grounded people, but you see now you also have another thing that has
like grounding
that has made you sit here all the time. It was difficult, but pole I said, okay, fine. Now what do you do? There are only two options. You either choose to be this or you exit. So I said, okay, I struggled with it. I wouldn't say it was easy. Just trying to master things. Pole, how do you live with this? There are kids here looking at you. Sometimes you're almost falling off your feet. So you get worried. You also worry, what are these kids? How are these kids looking at me? How are they looking at this man who used to be walking, big-bodied, now is macheted here, almost falling off. He doesn't want to eat this. He doesn't want to eat this. Asking. So I was also trying to provide answers
to them.
Questions that they were not asking, but I was feeling
filling the gaps.
Yes, internally these people asking me serious questions. Then now I was living in the same compound with my parents. So where we live is in Mamboleo. They bought some land, so I also managed to build a house in that same compound. So we share compound. So I also know these parents are looking at me and asking questions, but you see now nobody will come and tell you
directly
what is the problem, things like that. So we moved on through that half of the year. Then pole, I think I managed to just rise up, get energy through this. I realized, no, this is what I'm living. So what do I need to do? I need to continue living this life. So I got energy around it, friends around me. I also had a very strong community of friends, those who could drive from Nairobi and just come visit. But now the beauty of that was we don't talk about my condition. We talk about our normal stories.
We talk about other things, so it becomes like a break.
Yeah, so that was I think that was the therapy that I've had for all this period. So you meet people who call you, nobody asks you about you that one, leave it on the side. So we talk about other things.
Normal
things. Talk about work, football, school. Things we want to do, so those ones. So I think that has been the strongest point that has really made me manage through this. So I always say I'm only sick for the period I'm doing dialysis for 4 hours. Beyond that one, let's discuss other things. So that's how I look at it. So I think that is what has energized me through. So over time, in 2020, I slowly started coming back even to now, trying to get back to work. But now I'm just doing work in the house. So through my old networks, I was now trying to resuscitate these networks. So somebody could send me some work, I can review you some maybe project, I can write you, help you do a proposal, write some inception report, review you some report you're writing for consult, things like that. So then I also just made it open to them that if they have some assignments around Kisumu Western, I can always help them chip in and maybe
now that I'm around
here. So if somebody needs somebody to run errands around here, if the energy will allow me, I can always support. So things like that. So slowly after half of I would say half of 2020 from July there now, started actively now engaging back to my old networks, Mia, things like that. And then I think that's how I've slowed down till the end of last year. So yeah, Mia in 2022. Positive about things,
new energies,
keen on now working more strong and better than previously. I'm used to contemplating even looking for a more long-term job which I can be working beyond the
short assignments.
The short assignments I've been doing. So I think those are things I'm trying to contemplate at the moment. I've also mastered other ways of living, supporting my children better, family better. I can work, get money, and do a few things. So it's near normal, but it's not what I would have been doing if maybe this was not there. But I think this is what life has given me, so I have to take it up and go through that
and make sort of the best out of it.
So I think that's what I'm trying to do. Trying to get into things. In the process, I also managed to have some small community-based organization registered with some of my friends. So on and off, in my free times, I always do a few activities, though I'm also limited to the extent which I can do a lot of things with it, because I also don't move a lot. Then also interfacing with easy crowds and what, I always limit those things with our whatever underlying medical condition. You also don't want to expose yourself so much in a situation that might maybe cause you other problems. So I think that is where we are at the moment, being careful, but at the end of the day, life must go on. So you try and do that delicate balance, and so far I would say it's been working. And I think God has also been on my side with this. Yes, so that has been my story with this chronic kidney disease, kidney failure, dialysis. And along that, I think I've also taken up these issues about just raising awareness about
the conditions and
kidney disease, kidney health, kidney condition, disposing factors. I do it online on my Facebook page, Twitter. Then just speaking to people in the hospital. I would say I'm one of the active patients in that dialysis unit. I've also taken up through courses. Like now, we've had a lot of struggles with the NHIF trying to review and reform a lot of things that in some way has been causing a lot of problems to us. So I've also taken them up directly through letters, through press releases. I've done press conferences just on raising issues on kidney health on separate occasions. At the moment, I have a live case that I took, I think, 2 weeks ago on when NHF came up with the issue of reduced capitation. So where they wanted to reduce capitation from 9,500, which they reimburse facilities, to 6,500. But now saying that they're adding another session for dialysis. So I feel this is not what we need at the moment. So we feel the 2 sessions we're having is not the best. But what is available, I think we'd rather take it than the new one, which might have really serious quality compromises. So I took a case, a public interest case, to the High Court in Kisumu. So I think we are scheduled on 5th Wednesday for the hearing, where at least our prayers will be listened to by the judge, if they can be granted. So those are some of the things I'm trying out as an individual in this particular aspect. At the end of the day, something must be done. If nobody can do it, then I think maybe someone must to do something.
Yeah, someone has to do it.
Yes.
Yeah, it better be you.
For now, I think it's me now.
Yeah.
Yes. So I think that's a bit about my life journey through this condition and where it has reached with me for the moment.
All right.
Yes.
So, next question. In terms of now challenges, some of the challenges that you face, and I know you've mentioned them a bit in sort of the first part of this conversation, but will you now sort of mention them, and even some of them if you forgot? What are some of the challenges that you faced when you are sort of coming up, and when you realized? And this could go very broadly from sort of personal challenges to like community challenges, social network challenges, information challenges, and whatnot. So what have been some of these challenges, and how have you experienced them?
I think for us, I think the easiest way to put it is I think our life is just challenges. It would be defined, if I was to write a story, I think the best title would be challenges. Maybe if I would add other things around it. I think this is one of the most difficult life to live. Sometimes you wake up and you're not able to move. Yesterday you are well, just on your feet, you're able to do your own things. Then you went for your dialysis, took your 4 hours, you came back. Tomorrow you wake up, your leg can't get out of that bed, as simple as such. Any other thing you would plan for that day just collapses like that, as simple as such. So there is that one. The biggest thing was now I was not able to work normally. The first thing is now you don't have enough finances to do a lot of things. So your things are really lagging behind. There's a lot of things you wanted to do. You started a project here. You wanted to do this to your parents. You wanted to do this to your brother, and you'd also plan to do this. All of those things can't just happen. So you just have to accept that now the pace
has to slow down.
And sometimes they just have to set other things aside. Then you now have to accept that now you need to be there. You have to ask for support. Something, even if it was not something your life and your style of living. At some point it comes to you have to realize that you need people to really support you. You can't just manage this thing on your own. So there's that big reality. Then I think within your circles, I think I would say people don't understand you. I think that is also the other big thing. People don't understand what you're going through. Sometimes you'll get me walking, you might not realize this. Somebody goes through anything, and you see kidney somewhere inside your body. There, is not unless I speak about my story, or you knew me before. I think I was a bit bulky previously. I think now I'm around 70 kilograms. Those days I was 90. So, though, if you get somebody who knew me years ago, you realize something has changed. But I would say somebody I'm meeting today will not realize there's anything wrong with me. So there's that reality. It's also people don't understand what you're going through. Then if you're also this, I would say, strong characters like me. Sometimes you're going through serious difficulty. But you see, the normal face you'll put through sometimes get you mask a lot of problems, and people might assume you're well. But you're really going a lot of difficulties. You are really straining your life just to get other things happening. You also want to be a man. Also provide for your kids. You can't just be sleeping there. These kids will be coming, "Daddy, what's wrong with you?" What? Like, I have a small son. Anytime I'm always on the bed, just to ask, "You sick?" If you see a bandage on my arm, he has to tell me, "Go tell that doctor not to put this thing again." So you see, you'll have to smile, wake up from the bed, try and engage him in a story just to try and dispel all of this that you're fine. So there's also those ones. Then the other important thing is, I think this is one of the most expensive conditions to live with. I think I've spent a lot of money on this thing. For 2019 and 2018 to 2019 and early 2020, my wife used to work in a place where they had insurance. I think if I would take my receipts for those 2 years, I think it's something over 2 million that I was spending on and off hospitals, buying medication. Sometimes just go, you get these drugs, the injectables. Because now, if you have a chronic kidney disease, you are anemic. You are nearly anemic or anemic, because every other time you go through dialysis, that process of cleaning the blood, you also lose a lot of your natural blood. So you do a lot of these blood boosters, so iron boosters, and also there's also a component of blood called erythropoietin. So we inject this. So there is the cheapest one, which is least effective, to the best one, which is more expensive. So routinely, I would say I would go for dialysis like on a Wednesday. If I had 10,000 in my pocket, I'll buy one of those injectable at 5,000 shillings. So meaning that already I've dropped
by half.
Then there's also the other things. I was feeling unwell. You're sent to the laboratory, do this test like this. You might end up coming with around 1,000 shillings out of this 10,000 you just carried normally in your pocket.
Or in one day.
In one day. Leave alone that one. There are routine admissions. I've been admitted at, like, I kind of think 4 times, 5 times, things like that in the span. That was just 2020. And I think the least I spent when I was at the hospital was around, I think, 100,000. So if you had 4 visits, 5, you're almost at 500,000. I always ask, if this insurance was not there, who will be paying this cash?
Who will be paying the cost?
So those are some of the things you always. But then I always ask, even in our clinic, how many people have insurance here? Maybe 2 or 3 people out of the entire list of around 50 people who attend dialysis in an entire week. So the reality about this is so expensive to really have NCD in this country. And especially for me now, I have a living example of having a kidney condition. I think it's very expensive. That is just on medication. Then there's diet. Because you have a serious diet regimen where there's a lot of things you're not eating. You need to eat them, but you also need to eat them in moderation. So there's also the man of cooking. So this will also give you conflict with people around you.
They want to cook a certain style.
Cook in a certain style.
And you want it a certain style.
So you want, like, you have to do like a second cooking, so that you get what you want. Sometimes it becomes so difficult to really do that. Sometimes they forget about the instructions that you issued on how cooking should be done. Somebody just said, okay, let me just eat this. I think I'm also giving these people a lot of problems. So there are also those ones, then restrictions, like the things that you like most are things you're told you don't need to eat. So like mangoes, bananas were my favorite food. Those are the things that you're told you can't eat anymore. Meat was my favorite food. That is the things you're told you can't eat anymore. These other things you are required to eat are also things that they need to be bought all through, to be taken. So all those things, there's a lot of capital. Is a very capital intensive life that you have to live. So at every point, I always say you need money in your pocket. You just need some money around somewhere to always deal with something.
Because anything might come up.
Yes, so there's also that one. Then I think one of the biggest challenges that I also met last year, for us, you're told the best therapy would be a kidney transplant. So luckily enough, something around around April last year, my brother came through so that we could try if his kidney is compatible, so he could donate for me. We went through the test. We got to a point. It was discontinued. I think one of the tests.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.